Welcome and thank you for your interest in the Leading Systems Network. My name is Egbert Schillings, and I had the pleasure of hosting our most recent global conference. The Leading Systems Network is a unique community that convenes innovative health system leaders from around the globe. We share ideas, examine new models of care, compare performance, and identify opportunities to create value. But this is not another talk shop about healthcare, as you will see in the next few minutes. The Leading Systems Network is all about driving improvement in healthcare systems using some truly innovative approaches. Each year, our premier event is the annual Global Conference. It brings together the world's top healthcare minds to discuss the latest in healthcare innovation and improvement, and to reflect on what we've been able to accomplish as a group in the preceding 12 months. This year we had well over 100 attendees from 17 countries, representing dozens of health systems, their CEOs, chief medical officers, health IT experts, researchers, clinical leaders, and policymakers. Through a series of plenary sessions, vignettes on what works in health system improvement, panels, and highly interactive breakouts, participants engaged with one another on topics ranging from creating value along the colorectal cancer and diabetes disease pathways to using big data in health system management, the human capital side of innovation, and the implications of health reform in the US. All of them opportunities to engage with and challenge the world's leading health system thinkers. Since you were unable to join us in person, we thought we'd take this opportunity to share with you some of the highlights. Nikolaus Henke, who leads McKinsey's global health systems and services practice, opened the event with a framework to help system leaders organize their thinking on how to truly transform the delivery of care. Each of the 7 levers he presented was illustrated by success stories from around the globe. So we saw examples that range from technological marvels such as a pill that can transmit biometric data to your iPhone, to very powerful stories of redesigning services to improve quality and financial sustainability, as in the case of stroke service reconfiguration in London. Analytical rigor and insights from around the globe gave everyone a powerful sense that change is possible, and opening up the horizons and setting the stage for the next 2 days. Building on the theme of sharing what really works in transforming health systems, 4 of the nearly 50 C-suite executives in attendance were chosen to participate in a panel discussion. Rafael Bengoa of the País Vasco region in Spain, Robert Calderwood of Scotland's largest health board, Greater Glasgow and Clyde, Jack Cochran of Kaiser Permanente in the US, and Daniel Karam of Latin America's largest payer and provider system. Each one of them had been given a challenge in the run-up to the conference. Come prepared with a crisp encapsulation of what success looks like for your system in 3 to 5 years' time, and identify no more than 2 initiatives that have helped you get there in the recent past. All we needed to do now was to sit back and watch the unfolding torrent of insights, and one of the most inspiring and also spirited debates among health system executives any of us had ever witnessed. One of the key themes was captured in the most memorable fashion by Jack Cochran of Kaiser Permanente when he said that culture eats strategy for lunch, a point that sparked a rich debate because, while technology, infrastructure, and new models of care absorb much of the ink spilled about health systems, the panel discussion made it crystal clear that none of them will make any difference if we ignore the supposedly soft issues of culture and leadership. As one participant put it, adding new and flashy technology to an organization whose culture is not ready to embrace it will inevitably result in sunk costs without realizing any of the benefits the investment was supposed to bring. Through the panel discussion and the subsequent Q&A, the 4 leaders and the audience shared their success stories, but also cautionary tales of failure, both of which we would argue are key to shared learning. The session offered an honest, thoughtful, and often very witty take on health system leadership at the highest levels. Both days also showcased cutting-edge care delivery programs presented by the leaders who championed and nurtured these initiatives from their inception. Dr. David McCready outlined the brilliant work of the Princess Margaret Cancer Center in Toronto. They increased access and reduced the anxious waiting period for women needing biopsies for breast cancer from previously 36 days to a mere 24 hours. Jason Curry showcased Queensland Health's redesign of its chest pain services. Together with 3 other systems, Queensland had been part of our coronary heart disease improvement network last year. As a result of this joint work, Queensland implemented a number of initiatives that have resulted in decreased length of stay and a reduction in wait times for exercise stress testing from 6 weeks to less than 24 hours. Professor Bob Thomas rounded out the vignettes by detailing Victoria's integration of cancer services. Throughout a combination of better care coordination, increased outreach, and performance monitoring, Victoria has begun to see improvements in mortality as well as a reduction in performance variation. Victoria is also part of this year's Colorectal Cancer Improvement Network, which will provide a more granular and detailed picture of site-specific clinical practice spend and outcomes. All vignettes across the 2 days illustrate LSN's core mission, helping systems shorten the improvement cycle by exposing them to success stories from around the globe and connecting them to the leaders who made them happen. Each vignette was made available to participants as case studies as well, and if you're interested to learn more, please do let us know. Few events on the national political calendar of 2012 illustrate better the centrality of healthcare than the elections in the United States. At the core stands the Affordable Care Act, a complex set of changes and initiatives which was skillfully unpacked and set in context for us by Professor David Blumenthal. As a professor at Harvard Medical School, Chief Health Information and Innovation Officer at Partners Healthcare, and as the President's former Health IT czar in Washington, he was the perfect candidate to do so. The lessons he drew out for us on the vagaries of large-scale healthcare policy change and the future challenges they are supposed to address resonated well with people from every corner of the globe. In addition to panel sessions, vignettes, and keynote speeches, interactive small group breakouts are a key component of the Leading Systems Network Global Conference. This year, participants attended 5 breakouts throughout the conference on topics including the pathway approach to creating value in diabetes, using payment incentives to improve outcomes, and leveraging real-time data to manage performance. These sessions provide an opportunity for participants to not only engage more deeply with the content, but also to learn from other innovative leaders. In the session Remodeling the House, Reconfiguring Your Delivery System for Success, one participant from Denmark shared her first-hand experience in consolidating acute services throughout the region, resulting in a lively debate over the feasibility of similar initiatives in other regions. It is opportunities such as these that allow attendees to exchange ideas, challenge one another, and truly make the most of the Leading Systems Network community. We then turned our attention to one of the core activities of the network in 2012, which is to help 5 systems improve their performance along the colorectal cancer disease pathway. This program is chaired by Lord Ara Darzi, former health minister and preeminent bowel surgeon at Imperial College London. Lord Darzi's keynote address on lessons learned in colorectal cancer care was the perfect introduction to LSN's unique disease pathway improvement program. Lord Darzi was joined on stage by leaders from the 5 regional health systems engaged in this work. Over a 1-year period, these systems compare their clinical practices to an evidence-based best practice pathway. They measure key process and outcome metrics, map spend across the entire pathway, and all of it is designed to identify areas for improvement. Through this process, systems are able to answer the ultimate questions in healthcare, such as, for the money we spend, what value do we actually create? In a panel moderated by Lord Darzi, the 5 leaders discussed findings from the first 4 months of the project, as well as what they hope to achieve in the coming months. This conference is only one of the things that we do as the Leading Systems Network. We run improvement programs such as the ones I had mentioned on coronary heart disease, diabetes, colorectal cancer, among many others. We also perform analytics to help health systems identify where they should focus their efforts in an environment that is often increasingly resource constrained. At Boston, for instance, we showcased our recent deep dive on the issue of hospital admissions for ambulatory care-sensitive conditions. As health systems strive to shift care to the most appropriate setting and move away from an acute-centric model, this kind of analytical deep dive helps leaders make the ultimate case for change. And of course, we are a network, a membership of systems dedicated to sharing what works and helping each other shorten the improvement cycle to create real value in healthcare delivery for the benefit of the populations they serve. Thank you for your attention, and I hope that I have piqued your interest in our work. If you would like to learn more about the Leading Systems Network and how we can help unlock value in your system, please feel free to contact me directly via phone or email, or visit our website. The Leading Systems Network community is already looking ahead to next year's global conference. We do hope you'll be able to join us in London in 2013. Please save the date and be on the lookout for additional information in the coming months.